afternoon, everyone. So we are live now, and we'll wait for another 1 minute so that everyone can join, and then we'll start with our webinar number 41. Deepa Chauhan, ma'am, is the first one to connect. I think so. Dinesh Singh, sir, good afternoon. Reena Dev, ma'am, good afternoon. Very good afternoon. So I would like to share details about the channel. You can You can subscribe to this channel for regular updates on free webinars and live sessions. Definitely, if you are an enthusiastic learner, you will never ever skip this part, and you will definitely subscribe to Psychology, and don't forget to press the bell icon so that you don't miss any regular updates. After pressing the bell icon, you will be getting all the updates regarding webinar and live sessions on mental health awareness and psychology as a subject. Definitely, good afternoon, everyone. Swati Kumari, ma'am, good afternoon. I welcome you all. Shafia, ma'am, good afternoon. Dr. Chinna, sir, good afternoon. Okay, so we are starting with the webinar, but before this, I would like to give a brief announcement about an upcoming internship program from the team Psychology. The internship will be for 45 days, and the internship cost is 2,200 rupees only. So only the interested and enthusiastic learners can contact on our board line company number so that they can register on time, because we have very limited seats for the internship program. Yeah, this is the batch 3. We have already 2 batches running, and the first batch was totally for free, and that was a different part, but we are not counting that particular batch. So this is the third batch, and you can definitely contact on company number so that you can register yourself on time. The price for the internship is 2,200. The resource person for internship will be RCI verified and certified clinical psychologist. Yeah, good afternoon, everyone. Good afternoon, everyone. And we will start with the webinar. Okay, 27 participants have joined and more are yet coming. Okay, so I think it's the time 3:05 and we should start with the webinar. Yeah, Shafia ma'am interested, so you can directly contact on our company board line number so that you can register on time. This is the most awaited internship program. Actually, our seats go full usually within 2 to 3 days. So kindly register as soon as possible. We are starting the internship program from 15th of July. So let us start with this webinar. Good afternoon, everyone, and this is PsyCoolG Connect. It is an initiative by PsyCoolG Wellness Private Limited. I am Dinesh Seni, the director of PsyCoolG Wellness Private Limited. PsyCoolG Wellness Private Limited is an ISO certified and registered legal organization. So we are verified and recognized by Startup India, and we are also incorporated under Ministry of Corporate Affairs. We started this chain of webinars, and this is the webinar number 41, and I welcome you all. So we'll start with the webinar, and I would like to hand over the mic to Ma'am Garima so that Ma'am Garima can introduce our speaker of the day. It's on you, Garima ma'am. Thank you.
Thank you so much, sir. And good afternoon, everyone. I welcome each and every participant here in this webinar. This is our webinar number 41. So I welcome every participant in this webinar. And now I would like to give the introduction of our resource person. Today, our speaker is Dr. Jeny. She is an educator and psychologist with the experience of 20 years in teaching and 8 years in counseling. She has published more than 25 research papers. Her 55 articles has been published in various magazines circulated all over the India and outside India as well, and I wish it become 100 soon, and it will become. And she has attended many national and international conferences and workshops also. And our topic for today is dealing with depression. With it, I would like to give the mic to Dr. Jeny. Ma'am, it's over to you. You can start the webinar.
Thank you, Garima. Thank you so much for that nice introduction. And good afternoon to all the participants here, one and all. And my heartfelt thanks to PsyCoolG Wellness Organization for inviting me to participate in this venture. That is, they are providing a good hand towards the mental health of our country, I think. And today's topic is dealing with depression, and this topic is very relevant as far as the difficult time we are going through is concerned. So I invite all of you to attend the session from the beginning to the end, because it is towards the end of this presentation that I want to give a very important message. So listen. First of all, the presentation will be dealing with what is depression and how we can distinguish a person depressed from a person suffering from depression, and how we can manage the depression, and what are the views related to depression, and all these things will be discussed in this session. But remember, I haven't any ultimate solution to give. Whether you are, I'm not sure the configuration of the audience gathered here. There may be mental health workers, there may be counselors and therapists, all that, and there may be persons suffering from depression, and there might be persons who wanted to help their fellow beings who are suffering from depression. And never think that I am here to give the ultimate solution for this ailment called depression, because the fact is the correct solution for it has not yet figured out. We are on the path actually how to contain this ailment called depression. So without wasting the time, without delaying much, I am entering into the presentation. Please let me share the screen. Yes, let me explain. What is depression? Depression, it is a medical illness actually. And it is not just a feeling of ups and downs. We must be able to distinguish between what we call as blues and depression. Having the blues is very much different from having clinical depression. Depression is always known as common cold of emotions, because it is your emotion which is highly affected by your state of depression, and it influences like a continuum. Means on the one hand there is the feeling of feeling down or sad, and the other end there is clinical depression. On which side you are, you have to decide. Just feeling or sad, it is very, very normal. But clinical depression, it needs attention. Understanding depression, dear friends, it matters a lot, because we must be able to understand whether a person is suffering from this ailment called depression. Because being sad or being in bad mood is not a case of depression. We must know when a person, we can say that is suffering from this ailment called depression, in order to help ourselves and in order to help our fellow human beings, we must have some knowledge regarding this ailment called depression. Having blues is very normal and somewhat healthy. After certain events, if you lost your loved one and you are feeling sad and even dejected and even very much depressed itself for some time, and it is very normal and healthy. But clinical depression actually has 4 characteristics. The first is there will be some chemical imbalance in your brain, and the clinical depression will last for at least for 2 weeks. And the third characteristic, it leaves a person unable to function in his area of work. In what area he is functioning, he will find it is unable to function properly as expected by himself and his fellow human beings. And actually, clinical depression is an illness with some biological cause. And you must understand the case of depression or episode of depression influences you like a trident. Trident means acting in 3 directions. That is, if you are influenced, you are affected by depression, your body will be affected, your actions and behavior will be affected, and finally your cognitions will be affected by this ailment called depression. That is, you will be feeling in your body loss of energy, your sleep will be disturbed, there will be disturbances in your eating habits. Some people may be feeling low appetite, but some other people, due to depression, they will be trying to compensate the feeling of sadness by eating more and more food. And there will be recurring headaches, backaches, stomach aches. All these may feel when you are depressed. And in your behavior, there will be some differences. You may start avoiding friends, and you may experiment with drugs or alcohol in order to escape from the situation. And a loss of interest in things that you used to enjoy. You used to enjoy watching films, reading books, chatting with others. These interests you may lose due to the presence of this ailment called depression. And you might have some thoughts of suicide. And regarding the cognition, your concentration will be disturbed. You may feel unfocused, not able to focus on the duty or work in your hand. And your memory will be staggering. That is, especially your working memory will be affected when you are in a depressed state. And due to the same reason, you may find it difficult to make wise decisions, proper decisions. And even you might be thinking about committing suicide. And thoughts of suicide will dominate your content of thought. And in other words, there is a formula for recognizing this, whether the depression is there or not. And the experts call this formula as ABC formula. That is, depression influences or depression has an impact on your affect. That is, emotion, sadness, apathy, guilt, all will be there. And B, your behavior will be affected. And finally, C, your cognition will be affected. And these are some more symptoms in the line of depression. You may have feeling headaches, pain, feeling tired, anxiety and restlessness will be there. In many cases, anxiety occur. There is a maximum possibility for comorbidity of anxiety and depression. And there will be lack of motivation, especially when you are a student. And a decreased interest in sexual activity will be there. and withdrawal from friends, stomach problems, intestinal problems, thoughts of suicide and self-harm, and you might be feeling irritable, impatient, easily quick-tempered. The depressed persons, you can say that they may become quick-tempered, and loss of interest in enjoyment. All these symptoms can be noticed. At least some of them will be there in the person suffering from this ailment. And there is this MDD, major depressive disorder. The difference between the common depression episode and major depressive disorder is this MDD, major depressive disorder. It is a progressive illness. It occurs more frequently. And this is very much evident in major depressive disorder. What is it? Imbalance in neurotransmitters in your brain. Main neurotransmitters that are dopamine, norepinephrine, and serotonin. There will be considerable imbalance in the spread of neurotransmitters and also in the quantity of transmitters in the required brain regions. Dopamine, we know that it is the neurotransmitter which is instrumental in regulating our emotion, motivation, and all that. Any disturbance or imbalance in the distribution of this neurotransmitter may cause depression, and also norepinephrine, serotonin, all this, a balanced amount of these neurotransmitters in your brain is essential. For example, in the case of persons suffering from depression, it has been noticed that the quantity of dopamine neurotransmitters is very, very low, especially in a particular region called the nucleus accumbens. Nucleus accumbens is the region of the brain which determines our response towards the rewards of life, small and large rewards of the life. When the amount of dopamine and related neurotransmitters are very low near or inside or in the region called the nucleus accumbens, we feel low motivation and interest in life. And in order to decree that a person is suffering from major depressive disorder, there must be at least 4 of the following symptoms. And all these symptoms must last at least for 2 weeks. There is loss of energy, suicide ideation, disturbance in sleep, disturbance in concentration, appetite, and guilt feeling will be there. And the one more thing is retardation or psychomotor agitation might be there in the case of major depressive disorder. Now let us very quickly pass on to what is a kind of prevalence. How vast or what is the nature of prevalence is this ailment called depression. And World Health Organization declares that depression will be the highest ranked cause of disease burden, where in developed countries especially, actually. And regarding the prevalence, this is one report that is depression occurs in persons of all genders. There is no particular age group or gender or any particular background. We can say that this is likely to fall in, this person is likely to fall in depression. No, like that. No, there is no segregation like that. Irrespective of gender, age, and background, you may fall prey to depression. And it is the most common, affecting about 120 million people worldwide have been affected by this. But this is a report of some years back. Now it is, they say that latest report says that 130 million people have been affected by depression. And depression is among the leading cause of disability. And actually, this statistics of prevalence reveals a fact that actually depression can be reliably diagnosed and treated. But the problem is Only fewer than 25% of the people have access to the effective treatment resources. This is a problem, major problem. Only less than 25% of the people affected by depression is getting adequate treatment. And this is the state of our nation, that is India. According to the Times of India report, 1 in every 4 Indians are affected by anxiety disorders, and 10% of them are depressed. This is a report showing the comorbidity and the occurrence of anxiety and depression together. And the final report is more than 300 million worldwide are affected by this ailment, depression. And what about our country? 40 million in India has been affected. And now, in this time of difficulty of coronavirus pandemic, we can say that it might have gone multifold. And what is the problem? Such a prevalence. We know that coronavirus pandemic result in death in many cases, and we are witnessing the pathetic situation of death rate we are going through, entire world is going through. It will result in death. And in that pandemic, in that case, we can say that coronavirus is the killer. But here, all the depressed patients, as in the case of pandemic, all the depressed patients do not end up in suicide. But the thing is, 50% of the individuals affected by depression chooses suicide as a last resort. And 50 to 70% of all suicides have mood disorders as the reason for it. This is a report or a statistical report published in Indian Journal of Psychological Medicine, published in 2010. And in India, it is interesting to note the statistics of India. That is 1,20,000 people commit suicide every year. And 4 lakh people attempt suicide. And of this, 37.8% are below 30 years of age. That is a much younger population of India is in a pathological state. A good part of young population is suffering from mental disorders. And ministry officials state that majority of those committing suicide suffer from depression or mental disorder. And again, this is a fact. Only 25%, less than 25, are getting proper treatment. And what is the reason for this lack of access towards better treatment or proper treatment in depression? The reasons are this. That is lack of resources, lack of trained providers. We have a dearth of therapists and counselors and psychiatrists and psychologists who are efficient in treating this ailment. Yes, it is there. And finally, there is stigma attached to it. And there is another factor. That is, most of the cases suffering from depression remains undiagnosed for years. Only when the individual commits some untoward events or incident, we come to aware of this person had depression, has been suffering from depression. And the third factor, it is many people who are having some sort of mental illness or depression. A good part of our population depend on the religious beliefs, religious rituals, and their concept of this religious attitudes all work actively, and they prevent them from seeking a proper treatment for this ailment called depression. So, and even if the patients suffering from depression are getting proper treatment, the statistics says that, the research result says that patients do not even receive evidence-based treatment. Evidence-based treatment is the treatment supported by research outcomes and research evidences. And this is the gender. Females are more likely to get affected by or influenced by depression. And global burden is this 4.4% of the global disease burden is there instead of other diseases. Okay. Now, this is the final conclusion, that is 90% of the suicide cases, if we explore the reason behind or causes leading to this extreme steps in and such as suicide, we can see that 90% are doing it due to some mental illness. And of all the mental illness, which mental illness is most serious, or which mental illness is contributing towards suicide? It is depression and bipolar disorder. This is the next set of facts, that is 54%. Statistics reveal that 54% of the population suffering from depression believe that depression is a personal weakness. If a person is having depression, that means he is a weak person. It is a personal weakness. And 41% depressed women do not seek for help or seek for proper treatment, and 15% of the depressed patients commit suicide. And depression will be the second largest killer by 2020. Not all the patients suffering from or clients suffering from depression end up in suicide. So we must be interested in the things or factors, risk factors that are likely to lead a depressed patient to the option of suicide. What kind of persons are likely to end up in suicide due to this ailment called depression? The first is family history. If the client is having a family history of depression or substance or drug abuse, he'll have more chance to opt for suicide. And second, if the person suffering from depression is subjected to some sort of abuse on a daily basis, or continuous abuse is there in addition to the state of being in depression, such as physical abuse, sexual abuse is there is higher chance for that person to resort to suicide. And third, if you are in a toxic relationship, that you lack the support of your fellow beings, and you are in toxic relationship, especially in marital relationship, you are likely to commit suicide if you are depressed. And loss of loved one, if you lack social support, and if you have easy access to lethal means. If the client is having easy access to lethal means if for example, if he have the license of gun license is there for him, the patient, he is likely to, there is higher chance for the patient or client to commit suicide. And there are some protective factors. Even if you are depressed, you are going through depression episodes, but you have some factors to protect you. You are not likely to fall prey to suicide. The first one is if you have a strong family connections with the friends are there. And if you are a student and you enjoy your school activities and your relationship with the teachers and friends, you are not likely to commit suicide. And you have developed some skills, suppose you have developed some skills through your during your life's journey, that is problem solving skill, conflict resolution skill, and anger management skill. Such skills, if you have learned, you have developed in your personality, you will be less likely to opt for suicide. And if you have proper access to healthcare means not the presence of any psychiatrist and psychologist in your surroundings or within your reach. If there are some psychologists or psychiatrists or therapists are there, that is not enough in order to say that there is access to healthcare. The persons surrounding you, that is your intimate friends, intimate family fellows, family members must recognize that you are suffering from this ailment and you need clinical support. Then we can say that there is access to health care and beliefs. Studies say that, research outcomes say that those who having right kind of religious, spiritual, cultural beliefs, certain cultural beliefs also, are not likely to end up in suicide. And as said before, if limited access to lethal means. And this is the course of the depression. I will go through it quickly. If you are depressed and you remain untreated, your episode of depression may last from 6 to 13 months. If you are treating, it will last only for treating properly. It will last only for 3 months or less. And the third, you are treating and you are taking, suppose you are taking antidepressants and you quit taking antidepressants for before 3 months. Then what happens? Always result in the return of the symptoms. You will be going cycles of depression. And the next one, as the course of disorder progress, that is, you are not going through a disciplined treatment, the more frequent episodes you have to experience. Your experience of depression will be more frequent and it will be lengthier, that is, last longer. And over 20 years period, you might be having 5 or 6 episodes of depression. And what causes this depression? This is a question. If we know the right cause, we can eliminate it from from the surface of this planet. And what is the cause? There lies in this juncture, in identifying the cause of the depression. Now the state of corona pandemic virus is that we don't know what is the etiology, what causes it, how can we contain this virus. And the case of depression is more or less like that. There is no single cause to point out. There can be biological factors, there can be genetic factors, and there can be psychosocial factors, means stressful events, personality factors, and cognitive disturbance. And anything may lead to depression. These are the biological theories. These are only theories. We cannot generalize it. One reason may be your prefrontal cortex may be hypoactive, which is less active, that means hypoactive. And your hippocampus, if it is smaller in size, you are more likely to fall prey to depression. And if you are having some brain disorders, there is higher possibility. And as we mentioned earlier, if you have neurotransmitter abnormalities, there is higher chance for. These are the biological theories. And heritability, they say that 30 to 40% chance of death for getting depressed. Especially in females, it is 42%, and males, it is 29%. And psychological theories are there. Many people are interested in these theories. That is, Freud says that it is an anger. Depression is an anger turned inward. And anger, we experience it only outward. According to Freud, it is this. And the second thing, that is parenting. It is this argument that the parenting, the faults in the parenting, the errors in the parenting, such as abuse, parents sometimes becomes abuse, and neglectful parenting, rejection in parenting, all will lead to a state called depression in your offsprings. And this argument is getting stronger. Means that so many research outcomes are being produced that faulty parenting, faults in parenting can lead to the depression of offsprings. And the next is learned helplessness. Helplessness can be learned, according to Becker. That is another argument. And cognitive psychology says irrational beliefs and attitudes and thoughts, negative beliefs, and relationship and interpersonal difficulties may lead. In addition to all this, there are sociological factors. Now, all over the world, sociological factor is very much active. That is this coronavirus pandemic and the economic, financial difficulties and economic sociological impact this virus had on us, cultural, religious, everything has been influenced by this deadly virus called corona. In the same way, they say that these are other sociological factors: poverty, sexual abuse, physical abuse, role overload in your working place, role conflict, discrimination. All these social factors can generate this state called depression. And the very important thing is this finally: if the parents are suffering from depression, there is highly likely that your offerings are likely to become mentally disordered. That is anxiety, disruptive, depressive disorders. And this fact also, this thing also is being proved by research attempts continuously on a daily basis, I can say, because parental depression and the mental difficulties of their offerings are very much correlated, and the connection between them is very, very strong. And these physical conditions may also lead to depression, that is thyroid, adrenal diseases, Parkinson's, dementing illness, cerebrovascular diseases, and tumors. These also can lead to depression, that is migraine, rheumatoid, HIV, AIDS, cardiovascular diseases also. And this is very important: depression, relationship between the depression and cardiovascular diseases. Very, very important. We know that smoking can lead to cardiovascular diseases, diabetes, age, due to age. Your heart may get weakened, and gender. All these things has the power to predict whether you are going to get cardiovascular ailments. But the studies say that the stronger predictor of serious cardiac disease is depression. One of my friend is doing research in this area, and he has got evidence for it in Kerala. We have found that depression is worked as a stronger, as the best predictor of cardiovascular disease, especially in older adults. And the question is this: can depression cause cancer? Studies says that yes. 5,000 patients during this research period, longitudinal study in 4 cities, 1980 to 88. But now it is 2020, and the number of patients have increased manifold. That is 5,000 patients studies. And what is the mechanism behind cancer and depression? The thing is that they explain this state of depression has the power to alter your immune system and your cellular health, and cellular mechanism is to be can be influenced and result in tumors and gradually in cancer. And this is a serotonin pathway. This is the most accepted, because we know that the most developed area of mental disease is now, it is neuroscience evidences, neuroscientific evidences, neurobiological evidences. And this such proves evidences like this serotonin pathway, norepinephrine pathway, like that, anything related to the neuroscience have concrete evidence. So those evidences are very much appealing to both the psychologists and psychiatrists, and even to the common man itself. So according to the neurosciences, serotonin pathway, if it get disturbed, the way in which it is spreading in your, it is distributed in your brain regions, and the quantity of serotonin all determine. And neurobiology of depression, I am just putting it very shortly, that is very succinct manner I am representing it. That is, when you have serotonin and norepinephrine, when it is balanced, that is that two, you can see two blocks. When it is balanced, the amount of this two neurotransmitters are balanced, you will not be depressed. If anything, any one of these neurotransmitters shoots, increases or decreases, we say that there will be chemical imbalance in your brain. And this state is noticed in all depressed patients. So this is the reason or neurobiology of depression. But actual fact is cause of depression is a combination. We cannot point out one factor. This neurobiology or this neuroscientific evidence do not occur alone or occur in a single-minded manner. All these factors collude together. That is combination of genetic factors, psychological factors, environmental or biological factors. All will be there if you properly analyze the cause of a depression in a client who is having serious episodes of depression. You will end up pointing out in all these things, sharing all these factors must have their own share in producing a state or a state called depression in a client. Actually, even these things can cause depression. Just a workplace is enough to cause depression a particular individual. But at the same time, the same workplace incident need not end up in depression for another individual. Why? There is the difference might be in their personality or a neuroscientific disposition, their brain, the brain chemistry disposition will be a difference in there. Trauma, stress, all they may cause, all may contribute towards the depression. Now, question is how to help. The fact is there are no right or wrong things you can say. Just offer to listen. If you are not a mental health professional, if you are a mental health professional or not, whoever it may be, first of all, just offer to listen. Be sympathetic, non-judgmental. It is highly important. Never be judgmental. Be patient, calm, accepting. Don't be afraid to ask. Don't be afraid to ask what? Whether they have any thoughts of suicide in them. We feel that if we ask a depressed person whether you have any thoughts of suicide in you, we think that by asking that we are giving them the idea of suicide. No, it is not like that. Whenever you are dealing with a depressed patient, you must ask this question. Have you thought about how you would do it? It means suicide. Do you have any thoughts about it? Do you know when you will do it? All these questions must be asked. And not only that, if the person is very intent on, or if you feel that this person, a particular person is likely, there is higher chance for this person to commit suicide, call for help. Whatever resources from the help you can offer him, help him. And suicide hotlines are there, and keep good observation on him. Observe him and never leave him alone. Keep a tab on his activities and observe him closely. And these are the myths. We think that 1, 2, 3, 4 myths are there. We think that persons who talk about suicide will not commit suicide. It's absolutely wrong. The persons who talk about suicide will commit suicide. And suicidal people really wanted to die. Something that those who are thinking about choosing suicide, they will die somehow. There is no way to stop them. It is not like that. You can't prevent a person from committing or choosing this option called suicide. Talking about suicide will never cause the person to get interested in suicide. Actually, it is a fact. And these are the warning signs. You must closely observe it. A person who is going to commit suicide, directly or indirectly, will give you a hint. And he might have previous suicide attempts. And if you closely observe, there might be some abrupt changes in his personality. he might be withdrawing from friends, and he might be sitting moody and all that. And he might increase his intake of alcohol, and maybe using drugs. He might be appearing rebellion and hostile, withdrawing from friends, sudden drop in school performance in the case of students, giving away special possessions. All this can be noticed, the neglect of a person appearance and a feeling of hopelessness. All these are hints, and we must be aware of it when it is pointed towards us. Look, we all have idea that whenever a person is depressed, his face will be sad and the depression will be clear from his face expressions. But what happened in the case of this film star? He was always happy, actually. What depression actually looks like? He committed suicide, but he was always happy. So what the message conveys is that the person who is likely to commit suicide need not appear sad always. That is, depression, face of depression need not be evident from the appearance of the person. And this is a sad fact. The people aged 15 to 24 is the third lead suicide for these people between 15 and 24 ages. The third leading cause of death is suicide. And in America, about 14 young people commit suicide per day. What is the reason? This is not is the reason. Seeking help. A depressed person may seek help or may not seek help. We can understand this, but what we can, as mental health professionals, what we can think of is, what are the factors that prevent a person suffering from depression from seeking help? This is the first one. Many people feel ashamed. That is, stigma attached to the depression is the first reason that prevent a person from seeking help. They suffer in silence. But there are persons who come forward and declare to the world, I am like this. You must detach stigma from the depression, the case called depression. There are persons. So we must be curious to know what makes such people to declare to the world. Is it the social support? Is it the support from family? Or is it the interest in the well-being of other persons suffering like them? What factors lead them to, gave them the enough courage to declare the world their pathetic situation? We must be interested in it, and we must seek what are those factors. Because depression is not something to be attached with stigma, because as we know that 300 million people in the world is affected by it now. These are the treatment barriers, stigma and denial. The person who is affected by depression, as well as the person surrounding him, also may deny that he has depression. And somatization. Some people complain about their sad situation or depressed state through their somatic difficulties. That is, that pain, this pain, and like that. Comorbidities. And comorbidity make it difficult for the diagnosis of depression. And physician factors are there. Time limitations, limited treatment resources, as we mentioned earlier. And this is another thing. Most people rely on antidepressants, and there is a fact regarding there is a truth regarding the use of antidepressants. When you are depressed and you seek the help of antidepressants, there are two mistakes happening in every country, in every region. That is inadequate dose. The dose of the antidepressants you are consuming, either it will be high or it will be low, in the sense that the feeling, the way in which the depression is acting in a particular body, a particular person, will be different from the other person. So diagnosing accurate dose of antidepressant needed to cure the state of one individual will be entirely different from other. And doctors are not so dexterous enough to identify the accurate dose in most cases, and inadequate duration. How long you must consume the antidepressant? And there is many errors are happening. How long a person resorting to the help of antidepressants must consume this antidepressant? Is it for 6 months? Errors are treatment mistakes happen most often in these regions. And depression is actually common. It damages brain and body. Depression is treatable. What can you do? Talk to someone. That is the first point. It may be parents, teachers, counselors, clergy, family doctor, a responsible adult. Talk to them if you feel depressed. How you can help yourself? Take time to relax. Eat healthy diet, because what you consume matters a lot in your ability to deal with this ailment, depression, when you are depressed. The tiny example I can point out, that is the amount of vitamin D, the quantity of vitamin D in your body has the power to determine your mood. Yes, vitamin D3. That is, if you eat a healthy diet, you will be in a happy state or a balanced state. Get enough sleep. Exercise regularly. Regular exercise increases the happy hormones in your body, in your system, in your brain. Neurotransmitters function properly. If you do regular exercise, do something fun every day, get some support from family and friends, get help, never feel hesitant to seek help. And this is a question: what kind of people, what sort of people are likely to get recovered from the depression, this ailment? Recovery, full recovery. When it is likely to happen, full recovery? These are the conditions for that lead to full recovery of your state called depression. If you have good relationships, you have higher chance for recovery. Understand, if your therapist or client, psychiatrist or psychologist understand the real cause of your depression, you are lucky. You have higher chance for recovery. And learning how to create relationships. People differ in their ability to build up relationship. Some people may be introverts, some people may be extroverts, and some people may be relationship building skills. Such people are likely to, those who know how to create relationship, likely to recover properly. And next, identify emotional, cognitive, and relationship neuromuscular patterns. How much you are aware of your state, your emotional state, cognitive state, how much you are aware depends upon your possibility for the recovery. And a supportive group environment is there, you have higher chance of recovery. Relationship with the therapist matters. If you are getting an effective therapy, effective treatment, what is the kind of relationship you are having with your therapist matters a lot, whether you are going to recover. Studies in the therapeutic procedures or therapeutic counseling, researchers made in this area reveals it. And if you know how to boost your self-esteem, some persons know how to enhance their self-esteem by coming out and performing. Such persons are usually recover soon, and spiritual beliefs helps a lot. The fact is, everyone feels sad or down sometimes. It is a fact. You have to go through ups and downs, and down times are there. hurting yourself does not make depression go away. Talking to someone is the point. You must be ready to talk to someone about your difficult situation. Depression that logs work indicates that person needs. If your difficulties are prolonging, you must be ready to seek help. And this is the message, the cardinal message, important message I want to give. Till now, I spoke. I think almost all my audience will be more or less aware of what I said. They might have heard this fact from somewhere else and they are familiar with it. I'm just reminding it. But there is something new here onwards, that is views on depression. There are certain views of approaching depression, views on depression. Let us go into it. This is a cognitive approach. According to cognitive psychology, depression mainly occurs due to negative beliefs and negative attitudes around self, future, world. Okay, we all know that. Cognitive science wanted to interpret and approach the state called depression like this. And there is biomedical view, which says that depression is a disease of brain, especially psychiatrists. They say that you have to treat your brain with chemicals in order to get relief from this ailment called depression. Biomedical view, they see no meaning in depression. They do not view any meaning in the state, in an episode called depression. It's a medical condition, pure medical condition, and you must eat some chemicals in order to control, in order to deal effectively with your depression. This is a biomedical view. Okay, next. There is another view, that is meta-medical view. I wanted to spread this. I wanted to give this idea. You must listen carefully, everybody. According to meta-medical view, depression is not a disease or a sign. Actually, depression is a natural instinctual response. What is natural instinctual response? We have recognized 3 natural instinctual response to the stress-producing situations. What are they? Fight, flight, freeze. Whenever there is a stressful situation, whenever there is a threatening situation, we either fight, flight, or freeze. But according to this meta-medical view, depression is the 4th natural response to a stressful situation, actually. We must learn to view the depressive process. There is a process called depressive process. And it is 4th response of our system, entire system, to some stress-producing situations, whatever it may be. Depressive state is a consequence of depressive process, according to meta-medical view. Meta-medical view. I repeat, depressive state is a consequence of depressive process. When we fight with the depressive process, when we flee from depressive process, when we get stuck in the depressive process, we fall prey to depression. We become depressed only when we fight with, flee from, or getting stuck in the depressive process. But actually, according to meta-medical view, depressive process is a natural deepening process. Every individual must go through it. Every individual must allow themselves to walk through depressive process, because it helps to digest the meaning of events happening inside as well as outside ourselves. And it is an opportunity to get in touch with inner being, this depressive process. Antidepressant drugs. What does antidepressant drug due to the depressive process. Let me tell you, whenever you are in depression, when you analyze a depressed patient, you can see that he will be having a bunch of questions. What is the meaning of life? Why should I live? I'm not getting interested in anything. I don't find any satisfaction in this life. All these questions, most of these questions will be related to his existence, related to his meaning of existence and purpose in life. He will be losing it, most of the depressed patients. And when you take antidepressants, they will help to suppress these questions. This kind of thinking, consciousness is determined by the brain chemistry, and regulating brain chemistry means it will help to suppress the depressive process. It will help to suppress your possibility to turn inward and search the meaning of your existence, inner being, in order to connect with your inner being. This antidepressants take away that possibility. You will be undisturbed by the deeper feelings or life questions. You can see at the end of the paragraph, I have given a red color to that sentences. When you take antidepressants, you will be undisturbed by any deeper feelings or life questions that intrude into consciousness. Depressive process means you have to face those questions. You have to go through it. You should allow those things or the state of depression to carry you for some time. Then you can learn many things. And that learning will help you to deal with next episodes. That is depression. You will not have to fall into a state of pathological depression. And cognitive research says that it is a negative beliefs, negative attitudes, negative thoughts that leads to depression. But metamedical view says that it is our beliefs about depression that affect our experience of it. It is everybody is having nowadays. Everybody is having certain attitudes, preconceived notions, certain prejudices against this state called depression. And it determines our very experience of depression. This is what metamedicine says. They want us to practice metacognitive approach to our state of depression. That is, you observe your thoughts, beliefs, and all that, your feelings. The episode of metacognition means thinking about your own thinking. That is moving inward. Metacognition. I think it will take a long time to explain. It will take at least an hour to explain what is metacognition. However, metamedical view ask the individuals to practice metacognition whenever they are confronting with low state called depression. And these are the characteristics of depressive process. When you enter into your first episode of depressive process, whatever may be the reason, I'm not going to the reason. You are entering into the first episode of depression. What happens? You slow down. This depressive process asks you to slow down. It asks you to stop doing and start being. That is, observe yourself, observe your life, observe your life energies. Depressive process asks you. It is a time to recharge. When you are in depression, it's a time to recharge actually. Stops our mind going around in circles. Means repetitive thoughts or repetitive routines of moving the mind is changed. You have to change. You learn that. You have to change your ways of thinking and viewing things. And this depressive process allows us to digest events inwardly. This is the most important point. Depressive process allows us to digest events inwardly. When you take antidepressants or you suppress this process, you are devoid. You are losing this opportunity to digest events. inwardly and helps us feel our feelings. The depression episode helps us like this, helps us to face facts and face feelings. And new insights, the depressive process gives us new insights and responses to incubate. Yes, helps us to find our ground within ourselves and allows us to relate to others from our inner self. That is why this depressive process, meta-medical view, adjusts as a deepening process. And we need it. Detach depression from stigma by building a new culture of viewing depression as a necessity of life. We must go through it. As we know how to fight, as we know how to flight, as we know how to freeze from stressful situations, we must be familiar with this instinctual response of ours, that is depressive process. We must build a culture of viewing depression as the fourth response to the stressful situations. Then we can detach depression from stigma. It will be a common thing being depressed. You will not be considered as a weak person when you are depressed. And the final point is the studies keep on proving that depression and spirituality is very much connected. These are the states of the person who is in depression. Yeah, they feel misunderstood, lost, trapped, bewildered, worthless, confusion, doubt. Hang on, pain. Thank you. Thank you so much for listening to this episode. Here ends my presentation. And I think I have, yes.
Yeah, thank you, ma'am, for such a great and informative session. So now let's move towards our questions session. So let's start.
Yes, sure.
Okay, ma'am.
Yes.
Our first question is depression somehow related to overthinking? And if yes, then how? And on what stage this overthinking convert into depression?
Yes, overthinking. I will say overthinking is. I want to explain this in terms of meta-medical view. As you said, overthinking. I can explain the concept of overthinking from the cognitive science and as well as from the meta-medical view. Regarding the overthinking, means it's whenever whenever a person is in depression and do not get answer to his questions, he himself is trying to find answers to his questions, and in the process he may get subjected to some sort of anxiety will be there. Then overthinking regarding this his state leads to depression when he is not able to find answer to his questions, and thinking becomes, it takes a sort of obsession. It's a sort of obsessive nature thinking gets. Actually, the studies regarding the psychoanalysis paper, recently there has been published a paper in psychoanalysis. Why suicide is when the patient is suffering from the depression, what kind of persons are resorting to suicide? There was a question, there was a paper dealing with it. They say that according to them, only those persons who have that tendency to find a solution to their dilemma, they want to find a final solution to their dilemma, and they do not get that particular solution they want, they end up in suicide. But not all patients end up in suicide, but some patients reach the verge of overthinking, and it affects their cognition, their concentration, their memory, and as the time goes on, their function, it will affect their functioning and all that. And if it goes on like this, it will end up in degenerating their daily functions. And from meta-medical view, I would like to give some insight on this. During the meta-medical view, if the patient is well aware of this depressive process and the underlying mechanism, suppose this overthinking itself will be happening in a beneficial manner, actually. This is a meta-medical view. It will deepening his experiences if he is capable of indulging or practicing metacognition. That's the point I want to explain. I think I answered your question. If you want further clarification, you can ask me.
Okay, ma'am. And thank you, ma'am. And next question is it important to have a suicidal tendencies and characteristics?
Pardon. Question is not clear.
Ma'am, question is it important to have a suicidal tendencies in characteristics?
In societal
Correct.
tendencies in?
Suicidal tendencies in characteristic.
I'm not clear last word. Characteristics.
Yes, ma'am.
Which characteristics? So,
It's not mentioned in the chat box.
is it important to have societal influence in characteristics? Yes. The factors leading to depression, will there be any factor from society? Societal factors are there. That's the question, I think. Yes. When you are depressed, how the persons are surrounding you, your family members, your friends, and your other fellow beings, how they are responding or reacting to the situation you are in, matters a lot. So society, influence of society and the role of society is very important, or it is there in determining the level and the seriousness or severity of the depression in a client. Not only that, it will be some situations will be aggravating the state of depression. Even if a student is depressed, but his school is not so supportive in terms of mental health, in preserving the mental health or protecting the mental health of students, and his family is not conducive for keeping keeping a happy state in his life, all these things will contribute. And if you ask that, is it essential? There must be some societal characteristics, it should be there. The question is in that line. I will not say it must be there, because due to the biological reason only, if there is considerable imbalance in this neurotransmitters, that is serotonin and norepinephrine, is enough to feel depressed, and you need the help of a clinician or a therapist or counselor. It should be there. It's not like that, but contribution of it might be there. That's it.
Okay, ma'am. And next question is about what is childhood depression?
Childhood depression is actually it can happen in two ways. Either it will be genetic, and the vulnerability will be there in the child, in the person, in the beginning stage itself. We can notice it. But most of the childhood depressions are environmental in nature, especially from parents. Parenting is a potential source of causing this childhood depression. And childhood depression can result from other socio-economic status and ignorance of parents regarding how to give the good atmosphere for the child for growing up, and all that can cause. There is a particular definition for childhood depression. A child who and the children who is exposed to traumatic situations in earlier phases of life may feel depressed. But when a child feels depressed during his growing phases, he is likely to carry the experience and that vulnerability towards adulthood. There is higher chance. And who are the persons who can protect from children being victims of this ailment is most importantly, it is the parents. Parents must be well aware, because knowingly or unknowingly, parenting has the power to determine whether your child is going to have some mental difficulties or some other ailments. So, yes.
Okay, thank you, ma'am. And our next question is, what is pre-morbid personality?
Yes.
What is pre-morbid personality?
It's a personality, pre-morbid personality. It's a personality just before morbidity, reaching the morbidity. That is how actually. And actually, pre-morbid personality, vulnerability. It is indicating the vulnerability of the individual, actually.
Okay,
Yes. Mm.
okay, so move towards our next question. There's question that, ma'am, to treat a single individual with depression is easy, but what about if the okay, let me repeat. To treat a single individual with depression is
Mm.
easy,
Mm.
but what about if whole society is involved in depression and the reason behind that is not easy to solve? How to help in that situation?
Yes, whole society is involved in depression means that there is some wrong in our fundamentals of society. It might be cultural, and even it might be very social factors might be operating behind it. So how it can be rectified? The question, if it is depression acting at a societal level can be rectified, it is we need a bunch of persons who are well aware of this socially spread or socially prevalent nature of socially whole lot of society or collective depression, I will say collective. We need a bunch of persons who are well aware of the situation, the kind the people are in, and also the causes aggravating is contributing towards it. In other words, some people must be sane. Some people must be sane in order to treat the other, a group of persons who are insane. That is what I want to say, actually. Only then, because it is culture. When we make an approach, a social approach, or in terms of or collective approach is making, what we need is the persons in the leadership who is ready to, who can explore the cultural factors and social dynamics and their social dynamics. We need persons like that calibre. Only then we can, because such cases, depression occurring in a collective level cannot be corrected with a law enforcement and all that. But the persons in the leading positions, such as teachers, administrators, and other mental health workers, if they recognize the situation of the society and they dedicate towards the cause, we can eliminate it. And the question is not revealing the actual kind of depression. I mean, collective depression. Though they are indicating the collectively affecting depression, but they are not specifying it. The question is not revealing. So what I can say is this. Okay.
Okay, thank you, ma'am. Now there's one question: is antidepressant the only way to deal with depression?
No, antidepressant is the not the only way. Actually, in some cases, antidepressant is needed. In the extreme cases, you have to depend on the antidepressants. But in some cases, even if you go to a counselor or a therapist, you have to depend on the antidepressant for 1 or 2 weeks, for a short period, in order to restore the lost balance. When you enter into a depressed state due to some traumatic situation, we can see that the entire chemical balance in our brain and in our body system might have got berserk, and we have to restore the balance. We have to depend on the antidepressant. But once we get into the track of the therapy, or we smoothly move along the counseling process, or get into the therapeutic session, we can give up that antidepressant. Never say that antidepressant is the only option. It is absolutely wrong. If you identify in the initial stage itself your state, and your fellow beings are capable of identifying it, and you are blessed with a good environment and a supportive system, you need not depend upon the anti, because the depressive state is common. As I said, according to medical view, every human being goes through this phase called depressive state. How you deal with this depressive process determines whether you will need antidepressant or not, actually. Okay.
Okay, thank you, ma'am. And now I have thoughts like, what is the meaning of life? What should I do to solve it?
What is the meaning of life? Actually, this question, what is the meaning of life? To get answered, never look out. Each person have to turn inward and ask. If I ask this person to what is the meaning of life, I am asking towards his life. Your life is your side. And the meaning of it, you are responsible to find it out. Actually, feeling the meaning of life and finding it is an existential question. And at some stage in one's life, everybody who are born as human beings go through this crisis called psychologist and psychiatrist. Psychologists address this crisis as existential crisis. Everybody at some juncture wanted to know what is the purpose and the meaning of life, and they search for it. But it is a lonely journey. Nobody can you will get support from many philosophical resources or religious resources or some counselors or mental therapist or workshops or seminars. All these things you can attend in order to find, but the ultimate responsibility of finding the meaning of your life is yours. And it is, and to be frank, it can be found only through experience. By living only through experiences, you will find the meaning of your life. That's what I can say. Yes.
Okay, ma'am. Thank you so much for your answer. And if I will go through the chat box, I can see then there are so many questions also. Let me take the last two questions because I can see that we are running short of time and we have commitment with you at 4 p.m. that the session will be up to 4 p.m. and now it's 4:30. Thank you so much, ma'am, for being with us. And now I would like to take the question. Can we tell our client to use social media to show their emotions? Yeah, this is the exact
Show
question.
their emotions.
Yeah, this
Yes,
is
social
the
media to show. Yes,
yes, ma'am.
show their emotions. To whom?
Yeah, because
The therapist.
I would like
Yes, in
to.
this time. Yes, if you have been in the client has been in treatment for a long time with you, and you are familiar with the client, and in this time of corona pandemic, it is not easy to get in touch with the client. In that case, there is no harm in communicating with the client through social media.
Okay.
Otherwise, there is no need of it showing the emotions through the social media. Otherwise, it will be better to have face-to-face meeting.
Okay.
Okay. Because social media need not reveal the raw emotions always. Okay. Yes.
Okay. Thank you so much, ma'am, for this session. And
Any other questions?
ma'am, actually, we have taken, I think, almost all the questions. Let me check if there is any other question. When I'm checking for the questions, I can see that there are many feedbacks for you. I mean, positive feedback. Thank you, ma'am, for this informative session. Very nice PPT. Thank you, ma'am. Very wonderful session. Looking forward to attend many more sessions with you. A sweet approach overall. Ma'am, can you please come with a session on schizophrenia also?
Okay, thank you.
They have so many feedbacks for you, ma'am.
Yes.
Yeah, ma'am, there is one more question. A person who is well aware of depression and now undergoing depression after her mom committed suicide,
Yes.
but she is not ready to talk about it or take any professional help, then how to make that person get ready to go for a
Please, please repeat. Please repeat.
yeah, ma'am, I will repeat. A person who is well aware of
How is not audible actually? Please.
uh, now I'm audible, ma'am.
Well aware. No, no, no. A person who is well aware of.
Okay, a person who is well aware of depression and now undergoing depression after her mom committed suicide, but she is not ready to take talk about it or take any professional help. Then how to help in this situation so that the person will get ready to take the help from any professional?
Actually, you are not audible actually, but I got the question as a person is well aware of she is suffering from depression, but
Yeah.
she can't seek the help. Is that the case? She
Yes,
can't
ma'am. Yes,
seek
ma'am. Yes,
some or
yes.
other due to some or other reasons she can't help. Yes, then what to do?
Yes, ma'am.
That's a question.
Yes, ma'am.
Yes, yes. Then what to do? Yes, actually, if you are when the person is well aware that is he or she is depressed. That itself, that person is not denying and well aware of her situation. That is, it is itself is a positive sign. And she needs a clinical assistance. She feels that she needs the support of a counselor or a therapist, but she is unable to reach them. But I think there are some other means are there. She can at least she can begin from speaking to somebody who is reliable, maybe her close family friend. She can reveal the fact to her, that is, I need some clinical assistance, and mother, father, sister, brother, have a open talk with them and seek the help, their help first. And while doing so, need not feel any stigma in revealing the fact to the closed ones. And even if it is a close friend, you can share the situation with her. First, share. You must be able to share with somebody who is closer to you. Then after that, you can seek. I'm sure that you will be having, the person will be having enough opportunities actually. Speaking is the first step. I explained it into my presentation. You must confide somebody before stepping into a clinical phase or a clinical treatment phase. All alone, you cannot go through this treatment process called depression. Actually, you need support. Depression is a illness or a ailment like that. You need support of at least one or two persons. Okay. Yes.
Okay, ma'am. Thank you so much, ma'am, for this session. Actually, ma'am, I received this question second time. What is the correlation between vitamin D and state of depression?
Sure, it has been proved that in my clinic itself, I have found this fact. That is, one person have been attending our clinic regularly for this ailment called depression, because it is not for him actually, it is for her, for his wife. But we are giving the therapy. Almost all equipped therapists are there, and giving very disciplined therapy. But the wife is not showing improvement. Then we took her to advised her to consult some psychiatrist, to have some medical assistance, some the help of antidepressants. Then, listening to her history, the psychiatrist suggested a blood test, because he is an eminent psychiatrist who update himself in the researches without any fail. So he went for a blood test, and it came to know that the quantity of vitamin D3 in her blood was not proper, or it was very low, and due to that, and she needs that support. I mean, that supplement was needed, and with the help of it, she gradually developed her condition, and she was 99% now relieved from her difficult situation, actually.
Okay, thank you so much, ma'am. I hope that they get their answer. And thank you so much, ma'am, for being with us and giving such an informative and insightful session. And your PPT is, I must say, very informative. Your PPT is very informative, and most of the participants like your PPT, ma'am. Thank you so much, ma'am. And thank you so much for all the participants for being with us and attending this session. And definitely, this session will help you in some way. And I would request everyone to share this session so that the other people who want to take help and who can gain information from this session. Thank you so much, ma'am. And thank you so much, everyone. Now, I request Dinesh sir to please end this session.
Thank you, ma'am. Thank you. I really appreciate the efforts Dr. Ma'am had been put in the PPT. Basically, the PPT was totally awesome. The explanation was awesome too, and I thank you, ma'am, for such a wonderful session. And this was really very interesting and knowledgeable session. And I hope many of the participants will gain benefit out of this. Other than this, the session was totally interactive. I think all the questions have been taken from the chat box, and all the participants are able to interact with you through the chat box itself. Definitely, we will come up with another session by ma'am. Definitely, ma'am, we will call you back again. And
Yes.
I thank you, really. I thank you for this wonderful session, ma'am. This was really a wonderful session. Garima, I thank you too for being a wonderful host, and I thank Shivalika also for being there. Yeah. So with this, I would like to end the meeting. But before ending the meeting, I would like to share this. Like tomorrow, we will be having the webinar number 42. So you can come back and see the webinar on the page PsyCoolG. So you can just follow us on Facebook and subscribe the channel so that you don't miss any regular updates. You have to press the bell icon. Don't forget to press the bell icon so that you will get a regular update about the webinars. And I think all the enthusiastic learners who are the learner who basically want to learn something new and from some reliable sources, they will never skip this part. They will never ever skip this part, definitely. So with this, I would like to end the meeting. Also, I would like to extend that we are organizing a 45 days internship program, batch 3. So if you are interested, you can opt for it. You can directly call on our board line number. Thank you. With this, I would like to end the meeting. Thank you, ma'am. Thank you for such a wonderful session again. Thank you, Garima. Thank you, Shivalika. At the end, psychology is now PsyCoolG, and definitely we are there to spread awareness. Thank you.